welcome to Unleash Your Inner Goldilocks, how to get it just right. Thank you so much for joining us for another hour of engaging, exciting, and actually socially responsible conversation. So we continue to start building a world that behooves us and a world we will be proud of to bring the next generation in and leave something better than we found it. I cannot wait to get started. And this is going to be our last show as we bring in the holidays. So please make sure we take the time to absorb what's going on, be mindful of the season of giving, the season of joy, the season of spreading love and harmony. So let's get started. As we think of being a part of the Goldilocks community, what does it mean to you? What does it mean to you when you think of Goldilocks? To me, Goldilocks symbolizes that young, vibrant girl, a child, who knows what they want in life and who knows exactly how to go about getting it. They know exactly the temperature in which they want to eat their porridge. Goldilocks also knows when she sits on a chair, when she lays down on a bed, how hard or how soft it should be. She doesn't want it too hard and she doesn't want it too soft. She wants it just right. Think about how we were when we were kids and we knew what was just right. We knew either extreme wasn't going to work for us. It needed to work in a way that's going to bring out the best in us. Somewhere along the way, as we grow up, we forget that and we take these positions knowingly or unknowingly, consciously or unconsciously. And the positions we take sometimes prevents us from unleashing our full potential and thriving. Research shows that we can only impact three levels from where we are. Think about it, just 3 levels, right? So if I am taking an extreme position on any issue, let's say I'm taking an extreme right position, the only people I'm talking to and who can pay attention to what I'm saying and anybody who's engaging with me are already in the extreme right. And that's not many. And I can only influence 3 levels from where I am. Since I'm already at the extreme, I can only influence 3 levels towards the center being the operative word. Now, let's flip the script. I'm coming from the extreme left hand. Same scenario. Because I'm coming from the extreme left hand, I can only influence 3 levels towards the center. Now imagine I have invested the time, looked at different perspectives, and I understand. I don't have to be all of it, but I understand why the different perspectives and why different things mean importance to different individuals and different communities. And when I come from that centeredness, where I am slightly left or right of center, I am able to influence 3 levels towards my right, 3 levels towards my left, and everybody in that center lane. Imagine the power. I have taken that 3 degrees of influence, just 3, and made it into 7 degrees of influence, right? 7, that's a lot. That's more than double, right? Why wouldn't we want to multiply our options? Why wouldn't we engage more people? And remember, the most powerful thing in this world is not money power. It's not position power. It is influence power. The power of influence is what moves things. Power of influence is what gets people engaged. It's the power of influence that makes you a leader. Leader is not a title you give yourself, right? Leader is a privilege the people who follow you bestow upon you every time they choose to follow you. The operative word being every time they choose. So for people to choose to follow you so that you can be a leader, you need to find that centeredness so that you can have as many followers as possible. And you come from that place of centeredness to drive shared prosperity because you understand various perspectives. Keep that in mind as you plan your new year, as you plan your new year goals. Your success is predicated on you being empowered to see various perspectives. Almost like When you go out there and look at the light and you say, okay, light is bright and light is white. So white and black is all we see because it's presence and absence of color. But imagine if we can see all the colors in the rainbow. All of a sudden, the world becomes a more beautiful place. World becomes a much more engaging place, much more fun place. So let's build a world that is full of rainbows, that is full of options and opportunities. And we want to create our shared prosperity. Thinking about centeredness, even look at what your purpose in life is. Your purpose itself sits in the centeredness of what you love, what you're great at, and what the world needs. If you love something and you're great at it, but the world doesn't need it, you can't use it and provide it to the world to actually drive your economic engine. So you're not going to be financially viable. Therefore, everything you love and everything you're great at is going to fall on the wayside, right? If you're great at it and the world needs it, but you don't love it, you're not going to be able to sustain providing that service, right? And if you love it and the world needs it, but you're not great at it, all you're going to do is open the doors for people to realize they need it. And then somebody better than you is going to come and take that spot because they are better at it and the world is going to gravitate towards them. So when you think of what your purpose is, when you start crafting, hey, the pandemic is here, we need to start pivoting, we need to find out where the world is moving, and I want to find my purpose and show up where the world needs me in a purposeful way to do what I love. Think about that centeredness it's going to take. You're going to need other hands on deck. You're going to need other people along for the journey. And you want to find your centeredness as you find your purpose. 3 nuggets I want you to take into today's conversation. We're going to be talking about innovation. We're going to talk about how do we build our shared prosperity? How do we lift each other up and in the process thrive? Innovation is uncharted territory. Innovation, by definition, you're going places other people haven't. So remember to ride bravely into the unknown and create a path for others to follow. And when you're creating a path from that centeredness, and you understand and you come from a place of empathy and you see the buyer's perspective and the seller's perspective and all your stakeholders' perspective, you're going to be able to nurture and bring more people along. Okay, you want to be the Pied Piper of your innovation. So boldly step into the unknown and the road will rise up to meet you. The second nugget I want you to take into the new year and into your innovation journey is embrace the possibilities. Possibilities are endless. We're only limited by our imagination, lack of imagination, right? So world is full of possibilities. Gracefully embrace them. The reason we need to gracefully embrace them is arrogance is going to blind us and we're not going to see all of the nuances of the possibilities, and it will take us away from being centered. So with grace, embrace the possibilities, and your life is going to be full of fireworks. And the third element I want you to take into the future is lead purposefully towards the change. Purpose, that so important purpose where what you love, what you're great at, and what the world needs meets. Lead that towards the change you envision. And remember, flexing with finesse is leadership with purpose. Employ it to build shared prosperity, because if we're rigid and we just want to drive it through like a bulldozer instead of being a finesse player, we are not coming from the centeredness. We are going to antagonize our stakeholders. And therefore, we are going to have our purpose, our mission, the innovation fall on the wayside because we didn't show up the right way. With those 3 nuggets, I want you to get excited and put your hands together for this wonderful conversation we're going to have about making a case for the perfect healthcare match with my very special guest, Praveen Ponuru. Praveen, welcome to the episode.
Thank you for this opportunity. And good morning to everyone who is here today.
Wonderful to have you. Praveen comes from my part of the world. We refer to each other very friendly as brother and sister. I just recently met him. And I am super excited about not only what he brings to the table, but the vision he has for our world, and I mean our world for tomorrow. Praveen has a bachelor's degree in nursing with certification in nursing administration, nursing research, and clinical nursing. He has worked in management and recruitment for several home healthcare companies. He's working closely with the Ontario government to bring about positive change to the healthcare profession itself. He is the visionary mind behind Alpine Recruitment and Retention Solutions. So, Praveen, as we get started, you are doing a few things that are in the cusp or the intersection of traditional professions.
Yes.
So let's understand. And you came from India, you're in Canada, so you've crossed over, you're in a new world, you're in a new culture, you're in a new tradition. So as you bring all of this in, what got you here? How did you get here?
I moved to Canada in 2012. I was chasing my dream to become a family physician.
Mhm.
And when I moved here, I had to redo my nursing program in order to work in Canada. And I started working in the management side of things. I haven't worked in the nursing side of things in Canada. But in the last 8 years, I have worked for several home healthcare companies. And I realized a social problem, which is like the lack of staff to provide the best possible care for all our seniors. So every single time we look at the government coming up with new approaches and new solutions which are not sustainable. When I say not sustainable, to give you the best example, the government have concised the programs for nursing as well as for caregivers. So that is creating a lot of friction rather than a solution, because there are people who in nursing as well as in caregiving jobs who have been serving the communities for a very long time, and they have paid a lot of fees to go to the school, and they have did the programs for the full duration. So now when the government comes up with any concise programs, they are not happy to see people getting into the profession without any kind of purpose, because now the government is offering them like $5,000 bonuses to come and join this program, compared to someone paying for it because they were very passionate in serving people. So these differences that we have right now in the communities has further led to a huge crisis, and given the pandemic, because now you see there are so many burnouts happening in healthcare. At currently we have like 85% of burnout rate in healthcare, both in US as well as in Canada. And we are seeing record numbers of doctors, nurses, and everyone giving up their jobs and resigning their jobs. And everyone is familiar with great resignation. And there is no way that we can attract more people to get into healthcare profession when you have such kind of burnout rates or toxic work culture or lack of appreciation happening within the country. So I came up with a creative solution, because after I have seen all these problems working in the healthcare, there is no way that we will be able to serve the country and the seniors and public in general, because everyone needs healthcare regardless of the age.
Absolutely.
So I thought, okay, there should be a way, because every problem has a solution. Because when you look at a problem as a possibility to innovate, that is when you'll be able to think outside the box. So when I was looking into all the other options to see how we will be able to effectively address the challenges that we have today in healthcare to meet the needs of all the hospitals, long-term care, retirement homes, even the home care companies, I realized that there is a lot of talent in developing countries. To give you the best example, like Philippines, India, Zimbabwe, Zambia, I can name so many, but there are so many highly qualified, skilled people in those countries. While Canada and US, we have the money, we have all the advancements of technology, we have everything, but we don't have the people to get into healthcare to serve our communities and to serve our countries. So I realized, how about I create a database of people from all these countries who are looking for opportunities to come, because they keep looking up to US and Canada, because we are considered as best countries in the world. So that is how I have come up with a solution, and I have reached out to the government of Ontario, and I have proposed my solution back in 2019, saying that the baby boomers are increasing day by day. Right now we have 65%, and in the next 5 years it's going to reach 70%. And we are already having a huge shortage of healthcare workers. And Canada has PSWs, which is personal support workers. That is like 58% of personal support workers are the one who is taking care of all the seniors and their needs of ADLs. And when it comes to physicians and nurses, it's only like 20% in the medical profession that we have right now, both in US as well as in Canada. So, and these people are often not given the appreciation or the value that they deserve because they are not considered professionals. So we often overlook them and we don't consider them and we don't talk about them. But they are pretty much the pillars of the healthcare because they are the one who is providing the care after the treatments are done by the doctors or by the nurses.
Absolutely. And you bring up a great point, Praveen, because what we see in the Western world is the hospital system of doctors and nurses take care of you in that immediate aftermath of stabilization surgery. And then 24 hours after surgery, they send you home, right? And it's the caregivers who take care of you and senior citizens as part of the national healthcare process, or in the US, the Medicare process, it's part of home healthcare, right? So they might not be considered professional because they didn't go to medical school or nursing school, but they're still skilled labor. There's a specific skill required. So how can people start thinking about, it's not about being professional. Professionalism is a state of mind and how people show up, as opposed to letters behind the name. And then the skill and the empathy and the care that comes with it is an additional piece, right? So how can people put care back in healthcare? And we can't put care back in healthcare if we don't start caring about the people who provide that service.
The best solution that we have at this point to put the care back into healthcare is looking beyond the borders. And if we can find ways to encourage these people from different countries who are highly qualified and who are looking for opportunities to get here, I'm not saying that I will be able to give all the physicians a break by doing this, or I won't be able to give all the nurses a break. But my point is, for instance, to give you the best example, say we were able to bring 100 nurses from different countries to work as caregivers, which we are talking about the personal support workers or certified nursing assistants. What my company is willing to do is we are willing to help them to get their credentials and support them to do their license exams. So while they are already working in the system, even though it is the most basic job that they are going to start working and helping us, because we do have demand and we do have shortage of these caregivers that I'm talking about, like nursing assistants or personal support workers. By bringing these qualified people and putting them in the system while they are preparing for their credentialing and for their license exams, will give them enough exposure for them to prepare themselves to understand the healthcare system and the differences that each country has, like from wherever they might come. So if we are able to do this, some doctors or the nurses that are going to join our organization to come here might be smart enough to clear their credentialing process and get their licenses probably in 6 months to 1 year. Compared to the government's policies or the new approaches that they are bringing up with, like increasing the number of medical seats, for example, or providing a $5,000 bonus for people to come into nursing program, they are going to take 4 years, even if we attract so many students.
Yeah. Plus, they're going to come for the money rather than the purpose of serving.
Yeah. So without purpose, there is, as you have mentioned in the video before we started, if there is no purpose, then there is no value to it. Because they are just coming, you are just attracting the wrong crowd to come into the most noble profession, and they are going to eventually leave.
Mhm.
So all the efforts and the money, whatever the government is allocating to do to implement these programs, is going to be wasted. But if we look at this new approach of what I am suggesting, all these people already have the caliber, they already have proved that they really care about the communities, and they have been helping people in their country for a very long time, and now they are looking for opportunities to help themselves as well as to help their families, because there is lack of dignity of labor in
Mhm.
developing countries. Like for example, in India, nurses don't have any kind of value. Only doctors are considered like the highest, they get the highest respect, and they make like almost $300 for the entire month working as a nurse, compared to US and Canada, where the nurses here have dignity of labor and they will be able to make good living to support their families.
Mhm.
So the solution what I have proposed to the government is, considering the fact we have baby boomers at this point who are not able to get the care and who are struggling, if we can give an opportunity to these foreign workers, it will be a huge benefit and a win-win situation for both countries, because from day one we will be able to train them, and within the first 30 days we'll be able to equip them with all the scope of practice and every skills that is required, every skill that is required for them to get into healthcare. And that is also going to increase the overall economy of the government, because if someone
Absolutely.
is coming, yeah, if someone is coming into a new country and if they start working, they will start paying taxes. And there are so many benefits to this new concept that I'm proposing, because the caregivers who are currently working are burnt out, because I told you that we have 58% of personal support workers. So 58%, if we have to give them a break, we need people to support them. Unless someone comes in to fill these gaps, there is no way that existing employees can have a break. And if you don't provide them the break, obviously they are going to break down at some point and they will start
Mhm.
resigning the jobs. And this great resignation would be continuing more and more as we see.
And this is compounded by the pandemic, right? We already had the dilemma. And the pandemic has created a situation where the people who choose, for one reason or another, not to get vaccinated are the ones who are ending up in the hospitals. And this is causing the mutation of the virus to happen and continuously needing to be boosted, and healthcare professionals getting breakthrough infections. And I'm currently working in Belize here in the Caribbean, and two brothers who are medical doctors, both supporting, taking care of COVID patients, both of them died on the same day. And they were the only two doctors providing service locally. And there was this entire movement of, it is our freedom, we won't get vaccinated. And these patients, these folks who got sick ended up in the hospital and ended up killing the doctors, right? And so this creates a shortage in so many different ways, not just burnout, right? So people are getting sick and having to leave, they are dying, they are choosing to get out because it's not worth it anymore. Why would you care for somebody who doesn't care about what they're doing to other people? So all of this social dynamics are going on. But what I am hearing you say is there is an opportunity in the middle of all of this to bridge the economic divide that exists in the world that gives rise to all the other socioeconomic problems, and use the pandemic as a springboard for solutioning, so that we bring where the demand is and where the supply is together. That's basic business 101. As a business executive, this is what I do for a living: help organizations do mergers and acquisitions and go into new markets, right? Because the demand is there and we will bring the supply. So I see a perfect economic opportunity for countries to partner with other countries and start bringing people in, because if nothing else, the pandemic has taught us, if we don't take care of everybody, none of us are going to get taken care of.
Yeah.
And if there is a single person not taken care of, the virus is going to come back in different forms. And everybody who says we're okay, all of a sudden we're no longer okay.
Yeah. There are so many benefits to this proposal that I have come up with. If you look at it, we are not only able to address the staffing shortage, but we are also able to provide a break for all the people who are overworked in the last couple of years because of the pandemic. And then we are going to create a pool of nurses for the future. Because, for instance, if the government is going to provide a free nursing program, for example, it will take 4 years for them to finish their program. So it is not like they are going to come back in the next 6 months and start working to help our healthcare sustain this pandemic. But the credentials of most countries are pretty much equal compared to US and Canada. Like Indian education is pretty much equal to Canadian and US, where they will be able to transfer their credentials and they'll be able to get their licenses much faster than people coming out of the colleges from the physician as a physician or as a nurse down the line after 4 years or after 8 years, because we don't have that kind of time in hand in order to save the healthcare, considering the fact there are new strains coming out every single day and there is panic going around. And with this, as you have just suggested about the vaccination, people resisting vaccination, and they just choose not to get the vaccination, and when they get sick they're getting back to the hospital, which is also impacting doctors' lives as well as nurses' lives. So we have to look at the big picture of how we will be able to address this problem. And that is how I have created a database, and I have more than 2,000 people right now who are willing to come to US and Canada to help us with the healthcare while they are also able to help themselves and their families.
So this is such an amazing idea. It allows to address so many moving parts of problems we see, socioeconomic situations around the world. But there is politics involved here. So let me ask you a question. We are living in a time when nationalism, and nationalism doesn't necessarily mean people who are natives of the land trying to protect the land. This is about people who came as the first wave of immigrants claiming that the land is theirs and not wanting anybody who looks different coming in general, right? So that is what we mean by nationalism in the modern day, right? Not Native Americans wanting to protect the United States. It is the first wave of European immigrants saying this should be a Christian European nation, right? Because the natives of this country were neither European nor Christian, right? So when we have this in-name nationalism, because it's not true nationalism, right? In-name nationalism with that kind of protectionism and politicians courting those votes to stay in power. And as they get older, they need care, and people who look like them are not the ones who are giving them care. How does this dichotomy of all of these isms coming together? How are you navigating that?
How am I navigating is there are two ways in order to make my dream come true. One is, as you have suggested, talking to the politicians and asking them to buy into this vision, which is going to enhance the overall health of the entire nation, which I have already did, and I'm still waiting for the responses from the government, because I have had face-to-face meetings with almost 5 ministers so far. And they're taking their time, because considering the fact the borders are closed and it is on and off, which we are already aware of. But there is also another way to bring these people in, by talking to the CEOs of all the hospitals, long-term care and retirement homes, and proposing this solution to them. And if they are willing to give us a chance, and if they can provide employment letters, even for the most basic positions, like even to pull, like in hospitals, there are multiple positions below nursing that the hospital needs. Like if they can provide us with full-time employment letters saying that we need this many certified nursing assistants, or any kind of position that is available in the hospital that they currently need people to replace them. So if they can provide a full-time employment letter, then the people who I have in my database, they will be able to apply for their work visas, so that they can come to Canada and US to help us with our needs, while they can work on their credentials to become nurses or physicians.
So you're truly looking at a public-private partnered solution where the private sector says, we have this demand, but there is no supply locally. So
Mhm.
we're opening up these positions for people from developing countries who are already in these positions to come here. And in that process, we're also going to help them get re-credentialed, because medicine and law are the two professions where you need to get re-credentialed. Even if you go from the United States to Canada, you need to get re-credentialed, right? So it is not anything about where you come from, but every country protects its stuff. And so is that even necessary at this point? Has the world changed so much? These are questions we can ask, but I hear where you're going. What are the type of responses you're getting? Are you seeing people being open? Because there is money to be made here, right? So the minute you go into a business world, when there is an opportunity to make a profit by providing a service, businesses will be willing to negotiate, right? So are you seeing that willingness? Are you seeing people coming to the table?
At this point, there is resistance because people are worried about the new strains and the immigration. They are kind of resisting the idea of someone else coming into this country, given the fact that the borders are being closed and opened. So, but the question is, at this point, we are able to provide the care to the people to a certain extent, because if you see in US, there are so many hospitals who have reduced the services that they're providing to the public. The number of services are going down, and if this keeps continuing, at some point the hospitals will have to shut down. If the physicians keep resigning, and if the nurses keep burning out, and if they have to leave, obviously then there won't be an option for the government anymore, regardless of what status we are at when it comes to COVID. Because even if you look at the history, British enslaved India for almost 200 years, which you are aware of. But when they needed help to fight other countries like France or whatever in the wars, they seek India's help, and India helped them in order to save British. It is not like a something unique thing or as a rocket science that I'm trying to tell the government that there are ways to do it. This has been happening for almost 200 years now. Like there are other ways that there are other professions where the government is relying on, for example, farm workers. In Canada, we have farming industry who brings these workers from different countries like Nigeria or African countries, where we get help from them to do the farming for us. So this is no different from all the other things that the government has already done in the past. But it is all about they realizing the seriousness of the problem before it turns into a state of emergency where we have to close down all the hospitals.
Yeah, by then it's too late, right?
Yeah.
I'm a believer that we need to see the writing on the wall and start making changes proactively. Then we get to do the right things. But if we wait till the house is burning down, then we don't have options.
Yeah.
We can't do the best thing. We can't do the right thing. We only can do the quickest thing.
Yeah. That is where I'm focusing on, because I'm constantly reaching out to the government to recap this situation, because I have had meetings in the past. So I keep asking them to see if they are able to do anything about it. And I'm also talking to the hospitals at this point, and I'm trying to see if they can provide us with the full-time employment letters so that we can start the process, because it is going to take like 3 to 4 months at least, because there is work visas and everything that has to align with this process once we choose the applicants.
So as I'm you talk, the other thing that jumps into my mind, Praveen, is there is this huge push in the business world about inclusion, equity, and diversity. And I specifically go in that order, which is the polar opposite of how the titling works. Because coming from my Six Sigma and root cause analysis perspective, I believe address the root cause and the result will come. The world looks at equity first, but equity happens after inclusion happens, right?
Yeah.
So let's put the horse before the cart, and let's start including people so that we can create equity. And as we create equity, the diversity will come, right? So we have a great opportunity for businesses to put their money where their mouth is. And instead of just talking
Mhm.
DEI, they can actually start with inclusion and bring about diversity through the rite of passage of equity. And here is an international opportunity to do this and do this right. Have
Mhm.
you ever pitched it that way?
Yeah, because Canada prides itself about diversity, equity, and inclusion, because we are considered as one of the most diverse countries where we encourage different nationalities to be here. So that is one angle to look at, because the thing is, at the end of the day, we need help. And when we add different nationalities, it is going to diversify the society, as well as considering the fact there is resistance from time to time when it comes to different cultures. But I personally think DEI is going to be much more productive at this point, because it doesn't matter when you are sick, whether you are white, black, brown, blue, or purple. So
Mhm.
if you are going to get the help at this point, for instance, to give you the example, if say a white family is getting a help from a brown nurse or a black nurse at this point, it would at least change the ignorance part of it for in the standpoint of resisting the care, unlike in the past. Like say not someone was resisting the care in the past, where they wanted a white nurse or a white physician to serve them. And now that we don't have enough staff anyways, and if we can incorporate this the diversity, the concept of bringing different people from different countries, and if they are going to help them, at least it would give a higher benefit for them to actually think that we should consider other people as humans, rather than to look at them as a specific race, like brown or black or whatever.
Yeah.
So it is a great opportunity for
Mhm.
people to understand the human factor is what is needed. It is not about someone's color or someone's accent, to that matter.
Absolutely. Absolutely. And I really, at this point, want to open it up. We have live audience who have thoughts to add, insights to share, and maybe even a question or two for you. So let
Mhm.
me open this up. I know, Hugh, you have mentioned a couple of things, and Precious, you have too. So go ahead. And Robin, welcome.
Um, I was just
Thank
going to
you.
say good
Thank you for
morning,
the
everybody.
opportunity.
I'm sorry.
Good morning, Precious.
Good morning.
Oh, okay. Good morning. I was just going to say what you just said. I was getting ready to type. It was so overwhelming. Let me get it right. You're saying when we in accepting and appreciating diversity, you're seeing everyone as equal, as opposed to separating them in the, calling it race by separating us. I didn't say it as tactfully and beautifully as you did. But the truth is so basic and so powerful. It forces you to acknowledge the reality of humanity. When you have a need, and if you choose to resist, I mean, that won't make good sense if you have a severe need. And I put in there how our health unites us. We
Mhm.
all are born and die the same way, humanity, it
Yeah,
just happens. And when we are in the midst of that birth and then before our death, we need help. And
yeah,
it really, that's the only thing that matters. And to have someone to supply that need, someone, as in some human,
yeah.
that is the core of it. So I just appreciate it. I salute it and I'm all for it. But just thank you. That just was very impactful. I appreciate that.
Thank you.
Go ahead, Hugh. Thank you so much, Precious.
Well, I appreciate the opportunity to be here today. And when we mention about diversity, equity, and inclusion, as somebody who's watched this, it often seems to be what I consider a trendy topic and feel-good initiatives, and it's often lip service. So to
Absolutely.
provide actions matter. It's always I tell provide the proof that there is buy-in and you support it. DEI is not about a press release announcement on social media. We are DEI. I really don't buy a lot of this stuff, and I always tell leaders of organization, your actions matter. So that's how you build trust, and you provide that proof that there is buy-in. So so whenever I hear organizations on their social media, we have hired a DEI officer, or we are DEI organization, I say, show me the proof. The proof is in their action. So yes, there is an opportunity for Staffing Solutions to say you are there is buy-in and you can show that proof. So right now, like I said, DEI often I often call it lip service. And so there is an opportunity right now for organizations to show that proof.
And you're so right. You are so right. And ultimately, not showing the proof doesn't change anything, right?
Mhm.
We're just going with the same circus and rearranging the deck chairs. Go ahead, Robin.
Okay, turn my face on there. Oh, that didn't turn on. There we go. There we go.
Hello.
Great presentation and great to see Precious. And I think Praveen, you were on the same call that Precious was on when she was doing her presentation.
Yeah.
I absolutely love when you said a problem is an opportunity to innovate. That is really, really brilliant. And then Cass, when you flip DEI on its head,
Mhm.
that is brilliant. You're right. It has to include, inclusion has to come first,
Yes.
and then diversity, and then equity, will eventually follow. But if there's not inclusion to begin with, there's nothing to talk about. I was going to ask you, and I absolutely love what you're saying, Praveen, that these essential workers, as we've called them here in the US, people who are providing the day-to-day care, are so vital and so valuable. And my question is how to help them feel, to feel the power of their role. And so, for example, there's a real famous section in one of Martin Seligman's books where hospitals where the cleaning crews knew their why, knew their purpose. And one of the nurses was quoted, one of the janitors who's cleaning up the oncology lab where they're cleaning up the vomit and the excrement from, chemotherapy that happens when people have chemotherapy. She said, my role is equally important as a physician.
Yeah.
I am equal in this process. So my question is how to help the people who are providing the after surgical, in the home or in the long-term nursing facilities, how to help them feel the power of their role and that they are equal to the physician. Because you're right, in a lot of countries, well, in the US, definitely the physician is top of the food chain, everyone else is lower. But in reality, how can we help them step into their power and feel and to feel their purpose?
It's all about how you treat them, because they have been ill-treated all their lives working in all these developing countries like India or Philippines or any other country in Africa. So when they come here, they are going to go through a culture shock because everything is different. So my organization will be able to only provide them a 30-day training to equip them with all the skills that are required to perform the ADLs of all the seniors or any kind of public that they are going to help. But we can't make them feel appreciated, or we can't compliment them for what they're going to do to the public. It has to come from the people who are getting the care to appreciate them and to respect them and to show the gratitude for them to be here to help you guys in the time of need. That is what I think is going to motivate them to get their nursing licenses or to get their licenses to practice as a physician, because it has to come from both sides.
Yeah, I totally agree with that. Is there an element within the workers themselves by, doing some mindset work with them where if they themselves feel more valuable within themselves, could that impact how other people treat them and perceive them? If they begin emanating, I am worthwhile, as opposed to, I'm just this lowly person. Is there an element of that?
As you're asking that question, Robin, what comes to my mind, and Praveen, this is exactly what's coming to my mind, is Eddie Murphy on Coming to America. the pride with which he cleans the floor and mops the floor. So have that in mind when you answer the question. How do we make people feel that happy and that empowered?
Yeah,
Can I add something?
sure.
I would like to say that, you know, what I have, I've been in leadership positions too in the past, and I could say that most of the time what we get wrong when we do onboarding of employees or anything like that is that we try to do a generalized purpose and mission and vision, which often does not, what I call, lead to personalized purpose. It's a general purpose. And so when you do your mission and vision in a leadership position, I often will try to ensure that employees at every level understand their personalized purpose. That's a big difference between some leader getting up there and giving their mission and vision, which often cannot be personalized up to their level they're working. So as a cleaning person, you tell them what their personalized purpose is, which means you tell them, hey, look, your work is important because without cleaning this vomit up, we cannot have the workflow work efficiently. So, and we might even have to close up. So, you know, it's about giving employees, each of them, their personalized purpose in what they do. So whether it be someone who's taking the x-rays for a doctor, explain to them, hey, if you don't take good pictures of the x-ray, the doctor can't make the proper diagnosis. And you can show examples of great images that are taken by technologists that led to a great diagnosis. So every employee needs to develop that personalized purpose in what they do. And what I find out is a lot of organizations miss the boat on this is when they gather a whole bunch of employees together in a big auditorium and give them mission and vision, which often is the wrong way to do, in my opinion, because it really does not connect at that personalized level for that employee.
Very well said. Thank you. Thank you so much. Go ahead, Praveen.
The purpose of everything that I am doing right now is to help people who already had a calling. For example, if they are spiritual, we call it as a calling, or if they are not spiritual, we call it as passion. So the people, whoever we are trying to bring to these Western countries to provide the care, their deepest purpose is to serve the people. So I personally believe that they are going to be so fulfilled and they're going to be satisfied in whatever the job that we are going to provide them, for them to have a foundation in a new country and go further in their lives. So when it comes to purpose, I don't think when you add gratitude to the purpose, they are going to be much more dedicated and committed to whatever the work that we are going to offer them when they come into this country.
Good points. I love how the group is thinking through different aspects, and just like Goldilocks, right? Trying to see different perspectives, see all the colors of the rainbow. Absolutely love it. Go ahead. Somebody else had a thought?
I like how you brought out, Dr. Cass, about the nationalism piece. And when we look at things for what they are, not for what it's been distorted to be, it puts in perspective, for example, for other people to come from another country and then say, this is our country, and we get to guard it and determine who else can come in or not. In realizing that you want to be equitable, you know, with this whole movement, and by terming it, well, here's the opportunity. And you have already laid it out as to how it can be done. It's a supply and demand, basic business. It's the law of love and life, and allowing people who are here to be cared for efficiently and effectively and properly. And it's acknowledging we realize what some people before us, you know, what has been set in motion that has been inappropriate, that has been harmful and detrimental. We can do something about it. It just really makes a point of whatever people really believe, they have an opportunity to exemplify. And the fact that you've already laid it out. Are you prepared to meet resistance? And in what way are you able or prepared to counter it?
The amount of resistance that we have is kind of going down now, because people are able to understand that this is a much better solution than what we already have in the market, which is one of the reasons why it has taken a very long time for my company to be recognized or appreciated, because now I'm getting a lot of messages from even from Australia asking for help, or from other healthcare leaders saying that, oh, this is really a very good solution when we think about it, because it is benefiting every stakeholder, like, and it is also improving the diversity DEI, which Cass mentioned, because I haven't thought about in that perspective until she pointed it out. And even the equity, the pay equity is one of the biggest challenges that can be addressed through this solution. Because if you look at the travel nurses that you guys have in United States, it is very unfair for me to be a nurse and work for a hospital to serve the public and get paid $45 per hour, while I see one of my friend working for a travel agency getting paid $95. It this solution, whatever we are proposing, has different dimensions to it, where it can help with burnouts, where it can help with pay inequities, it can help with DEI, and it can also help with the global economy. So at this point, whoever is resisting it are the ones who is going to probably come back at some point and say, hey, you know what, this is the only way we are left with.
Mhm.
So that is where
Mhm. And by the time they come to you, the horse has already left the barn. Right? So go ahead, Robin. One last comment before we go into closing. Go ahead.
Yeah, just one quick question. So if in the practical terms, how are you dealing with the various countries, like coming into US, coming into Canada, dealing with and hopefully streamlining the process for people to come in? And I know you mentioned everyone's nervous now about all the COVID variations, but even without COVID, being able to come into the country, is there a way you can help streamline that process?
I'm actually working with my team right now to streamline this process, because this is way beyond my purpose to begin with, even though I have come up with a solution that is going to benefit the entire humanity. But I do need the technology piece of it, where we can use technology to our advantage, where we can provide all the applicants to the hospitals or to anyone who is requiring this help, so that they will be able to scrutinize the applicants to see who they really want to select to bring them in. So we are still working on that part of streamlining things, and we do have a meeting today afternoon. So once I discuss with my team, probably I will be able to provide you with an answer.
Yeah, that's great. Thank you very much. I know you're working hard. It's a wonderful thing you're doing. It's so creative.
Thank you so much.
I am so excited to see the interplay and the exchange. And so what you're hearing here, Praveen, is when all of these pieces fall into place and you're ready to hit that warp speed go button, you already have some of your strategic guidance advisors and partners right here with you having this conversation. And to me, that is the beauty about being part of the Goldilocks community, right?
Mm-hmm.
You have the ideas, you have the solutions, and together you can get it just right.
Yeah.
So as we go into close, Praveen, what is the one thing in just 30 seconds? What is the one thing you want people to take with them as they go into the world today, tomorrow, and think about what you are saying and how they can use it to change the world?
The only thing is that I'm very thankful about is the team of people that are supporting my vision at this point. And when you have a team of people supporting whatever you're doing in life, it doesn't matter whether it has to be a business or whether it has to be solving a problem. It is always the best that when you share something with a group of people that you really trust, and if you have their back, there is always possibility for us to grow rather than to do things by ourselves. So that is one thing that I have learned, and I would love everyone to encourage doing that as we approach into New Year, because meeting you was an honor because you have asked me so many important questions, which made me think through the processes to come up with a solution for it. So if you have any kind of idea, it is always better to share it with people and get their feedback. And that is how I personally think. And that is the kind of leader I want to be, where I would be vulnerable to admit the fact that I don't have an answer or I need help. So the myth of saying that asking for help is a weakness is something that I would like to change, and I would want everyone to realize that asking for help is a strength rather than a weakness.
Absolutely. And that by itself is extremely powerful, Praveen. It not only shows people who you are as a leader, but it is also showing that you are willing to put your money where your mouth is and show up in a way that you are going to include and you are going to share, because your goal is not just accomplishing your purpose, to get it just right. And to get it just right, we need all hands on deck.
Yeah.
And I couldn't have said anything more brilliant to bring
Thank you.
to a close. So thank you so very much, Praveen. We, as a Goldilocks community, are super excited for the change and the positive transformation you are going to help bring, and the community is ready and here to support you.
Thank you so much.
For those of you who have joined this conversation today, I am eternally grateful for your insights, your thoughts, and you are what makes Goldilocks community work. So thank you so very much. If you need to contact us with ideas and suggestions for the shows, email us at cass@casshenry.com. Go to our YouTube channel, Transform with Dr. Cass, and subscribe, get engaged. And you know what? Let's go out there and meet people, and through our conversations, take on the opportunity to transform lives, because every human interaction is our opportunity for transformation. Go out there, transform lives, and in that process, don't stop transforming yourselves.